I'm a former New York State Supreme Court Justice. Let me tell you about a real case story. It probably is the most amazing medical case that we've ever encountered. It has two component parts. One part is the disease part. The other part is the part about a brilliant neurosurgeon or brain surgeon. First, the disease part. This is a disease that affects approximately 1 million Americans in our country. It's a disease that is very debilitating. It gets worse each year to a point where those victims who have it suffer terribly, and they have a very, very disastrous end of life at some point. That's the disease element. Out of respect, out of sensitivity, I'm not going to mention the disease. We'll call it disease ABC. That's component one. Let me take you to component two, the brilliant neurosurgeon or brain surgeon. Now, this disease has always been treated with drugs, with chemical therapy and things of that kind. But this brilliant neurosurgeon who made research, read all the scientific papers, and devoted much time to this disease said, I have to find a cure, a surgical cure for this disease. And he developed the hypothesis. He said, this disease has to start in the brain. There have to be certain brain cells that are not acting properly. He said, if I could only get into those brain cells and destroy those brain cells, then I may find a surgical cure for this disease. Now, in order to find these brain cells, he developed what was known as a type of photography, a stereotactic photography, setting up cameras, many cameras in the operating room that would interject and intercept each other, almost like a bombardier in an Air Force airplane, to target those bad cells. And he was able to do that. Once he was able to target what he perceived to be the bad cells, then he had to have some way of getting to those cells to destroy them. He took a surgical drill and he drilled a hole right through the skull, very tiny hole, very narrow hole. And using this stereotactic photography, he was able to target what he perceived to be those cells that were producing this terrible, terrible condition. All right. Now, once he made this hole, he then introduced a long cannula into this hole. Now, the cannula is like, what can we describe it to? A straw. It's like a straw. Hear me out on this. It's like a very narrow straw. And through this narrow straw, he put in frozen nitrogen called cryosurgery. So that this cryosurgery, once it gets to the target of these bad cells, would destroy the cells. And it was his hypothesis that if he could destroy these cells, then he would find a surgical cure for the first time in the history of this terrible disease. Well, he had a patient. Patient was probably in the terrible stage of this disease. And the patient volunteered himself. Consent forms and things of that kind. And the surgery began. And this neurosurgeon, this brain surgeon, performed exactly what I described. within 3 or 4 days. Miraculously, the symptoms that this poor person had, this decimated person had, almost disappeared. It was a miracle. This neurosurgeon called upon another patient and performed the same kind of surgery. Same result. Symptoms disappeared. It was a miracle. He did it with another patient and did it with a number of patients. Well, the word got out to the neurosurgical community that there was a possible surgical cure for this terrible disease that afflicted 1 million Americans. He appeared at seminars. He was called all over to describe his finding, what he did. Now, 3 or 4 or 5 months later, the symptoms started to return. Not only did they return, but the patient became worse than the patient was before the surgery started. A terrible, terrible result. And as a consequence, this entire surgical procedure, which was first defined as a miraculous surgical cure for this terrible disease, had to be abandoned. And with that abandonment, the neurosurgeon, this brilliant brain surgeon, went back to the standard practice of neurosurgery. Now, there were a handful of patients out there who were in a worse condition, and some of them brought cases. And we were involved in one of those cases. Fortunately, the brilliant surgeon had the foresight to have sufficient insurance so that in every single case that he operated upon, the insurance carrier settled every single case. Now, this was a well-meaning doctor. This is a doctor who had the best intentions in the world. But even the best intentions in the world does not excuse the doctor who performs treatment of some kind, that is below the standard of care. And if that treatment that is below the standard of medical care produces harm or injury to the patient, then that doctor, as well intended as he or she might be, is held accountable, as was the case in this particular situation. Well, that's it. That's the end of the story. And until we meet again, this is a storyteller telling you to stay safe and keep out of danger.